Hello all. Today we'll be discussing about lumbar traction, an important physical therapy technique used in the management of lower back disorders. So it's a part of exercise therapy unit and something you'll frequently encounter in clinical practices. Yes, coming to the introduction of lumbar traction. Lumbar traction is a therapeutic technique where a distracting force is applied to the lumbar spine. Why do we do this? So, to relieve pain on the spinal structures like discs and nerve roots, to help in pain reduction, muscle relaxation, and to support healing. In simpler words, saying traction works by gentle pulling the lower spine apart, which can help in many conditions that cause back pain and discomfort as well. Yeah. Um, Coming to the mechanism of lumbar traction, so let's break down how it works. So the first thing is spinal elongation, that is traction increases the space between the vertebra, so it helps in reducing the discompression and nerve root impingement. So the second thing is muscle relaxation. It stretches the paraspinal muscles, which decreases muscle spasm and improves the blood flow. And the third thing is joint mobilization. By separating the facet joints, it improves mobility and restores the normal joint movement. So, what are the core principles behind lumbar traction? Now, there are four key principles you must always consider. The first one is force application. So, the amount of pull should be always adequate but also safe. The second thing is patient positioning. So, the proper alignment is very crucial. So, usually done in supine or prone positions depending upon the goal which we are acting upon the patient. The third one is duration and frequency. The sessions usually lasting between 10 to 30 minutes. So, it is repeated daily or 2 to 3 times per week, and depending upon the patient response, always monitoring how the patient feels during and after the treatment is very mandatory and more important than any other thing. Yes, the fourth one is the method of lumbar traction. So there are two major methods of application of lumbar traction. The first one is manual traction. So it is done by the therapist's hand. So provides immediate feedback and can be adjusted based on patient's response. The second one is mechanical traction that involves the use of machines, offers sustained intermittent pulling and is ideal for longer and consistent sessions. So we also have different traction modes, that is continuous traction. So in continuous traction, a low force applied for longer time for good muscle relaxation. The second one is intermittent traction. So the force varies in cycle, encourages disc fluid exchange and pain relief. The third one is sustained traction, a constant force for shorter period that is effective for joint separation has been applied. So depending on the diagnosis, traction can also be targeted and broad based. So in targeted, focusing on single spinal segment will be done, whereas in broad based, spread over the entire lumbar area. Such kind of treatment will be given. Yeah, this is what I've told about the continuous, intermittent and sustained kind of stuffs. Yes, coming to the method of application, this is what I've explained before, that is the targeted traction and the broad region application. Coming to the key parameters of lumbar traction, the force, duration and frequency. So when applying lumbar traction, these are the three parameters that is very critical. The first one is force. Start with 25 to 50% of the patient's body weight, whereas duration it is nothing but 10 to 30 minutes, whereas frequency typically daily or whereas up to 3 times a week also be given. So they should be tailored individually depending on the patient's conditions, tolerance and response of the patients. Yeah, clinical consideration and indication for lumbar traction, it is nothing but we use lumbar traction in various conditions such as disc herniation, radiculopathy, muscle spasm, degenerative disease, facet joint hypomobility. In disc herniation, it is given to reduce the nerve compression, whereas to reduce radiating leg pain, we'll be giving radiculopathy conditions. And whereas in muscle spasm, it helps in relaxation, and in degenerative disc diseases, it improves the disc spaces. And whereas in facet joint hypomobility, it mobilizes stiff joints. It is always evaluate if the patient is in a good candidate. Some may have contraindications like severe osteoporosis, fracture or cancer. Coming to the conclusion, lumbar traction is highly effective non-invasive technique. It should be based on accurate diagnosis and individual parameters, and most importantly always assess, reassess and modify patient on feedback. Yeah, this is all about the lumbar traction. Thank you.